I'm Mike Newman, running for 4th District Supervisor for the County of Humboldt. And I believe that the top three would be evident issues of homelessness, addiction, and mental illness, especially for those who camp near businesses. Number two would be workforce development and retention. And number three is lack of childcare services. While we have developed strong approaches to end homelessness, we have done little to keep people from slipping through the cracks and becoming homeless in the first place. As a result, many argue that what we are doing must not be working, since homelessness still exists. The problem is that we have not turned off the faucet. We must stop the flow of people into homelessness. This work will require collaboration at all levels of government between multiple systems: mental health, housing, healthcare, criminal justice, child welfare, education, domestic violence, immigration, labor, and others. We must work together across federal government and state and local officials with private philanthropy to create systems and funding streams to better identify people at risk. Risk of homelessness or mental health, and intervene earlier in order to keep them from losing their homes. We are on the right track for our community to develop our workforce with the recent change in our state university being designated Cal Poly, and efforts of leadership to implement that style and that type and style of curriculum. And this is in conjunction with the direction that our college has forged with our local high schools and the local workforce development board, of which I was a part of for many years. We need more skilled workers as we attract businesses to our communities. And I see that my time is lapsing up, so I will finish with, take a look at my written piece for the last little part on this. I've been in private enterprise similar to what you have been. I have had my own insurance office. I've had to make payroll and face those decisions that many small business owners face when they employ workers. The employee's wages are always paid out first, and then other bills get paid. I've had to balance a budget for my business, and I've had to manage workflow and hire talented people. In other words, I've been in the trenches and walked their walk. I've served on the Measure Z committee, making sure that Eureka got its fair share so that they could operate the MIST program, which would lessen the effect on businesses in Old Town and our police department. I have and am serving on the county's planning commission, and I understand the difficulties of development and how burdensome those extra regulations can be. It is a misconception that government can fix business or the pressures they face. What county government and specifically the Board of Supervisors can do to assist business is provide an environment in which businesses can thrive. Businesses, especially here in Humboldt County, will figure out how to survive. Government establishes regulation that affects business, and government needs to apply the regulation in a consistent manner across the board. The Board of Supervisors sets the tone for the application of these regulations, and they need to be sure they are sending a clear and consistent message to their staff on how to apply these regulations, a message that supports the business community. I believe the budget and the current crisis with the Auditor Controller's Office is with their untimely reports to the state. I haven't been able to completely delve into these topics to give them the time that they need to render any insights or input. And I believe the Board of Supervisors is working on this issue with their full attention. Another issue that I'm aware of and that touches our whole community is the issue of access to our hospitals and healthcare. As a board member of the Providence St. Joseph Community Benefit Board, I've been privy to the difficulties of attracting and keeping healthcare providers. And providers are of all types across the board. from healthcare worker to nursing to physicians. They are all needed. One particular crisis that is and has been building is the mental health crisis, with lack of facilities to triage and treat. And because of that, our emergency rooms, both St. Joseph, Redwood, and Mad River, have been overused because of the requirement that they have to treat anyone that goes through their doors. It is my understanding that there is a stakeholder group of decision makers beginning to explore strategies to help us move forward and engage the entire community in playing a role in addressing these critical needs. This is important because it will free up our ERs to treat the emergencies that are medical and that occur and need to be treated in a timely manner for our citizens' needs. In particular, I want to draw attention to a several million-dollar state grant with DHHS Behavioral Health is working with Willow Glen. And I believe my time is about up, so look to my written statement on this after this